Aloha, I am Mark Alexander, Executive Director of the Hawaii Medical Association. It is my pleasure to welcome you to this edition of Conversations at HMA, a program which features discussions with physicians and other healthcare leaders around healthcare issues here in the state of Hawaii. This evening's panel is entitled Legislative Update Number 2, Getting Over the Finish Line. Before I introduce our panelists for this evening, allow me to go through some of the logistics. For those who are on Zoom, we invite you to actively participate throughout the presentation by adding your Q&A into the Zoom feature. And then we will feature as many of those questions as we can after the primary discussion takes place among our panelists. For those that are here in the room, we ask you to use the index cards and hand them to either Mark or myself. And again, we will try to feature as many of those as possible. As is our practice, this recording will be available within a week on our YouTube channel that you can find obviously on YouTube. So now it's my pleasure to introduce our panelists for this evening. Leading our panel will be Dr. Elizabeth Ignacio, an interventional radiologist based on Maui. She is chair of the HMA Public Policy Committee. Our other two panelists are our co-chairs of the HMA Public Policy Committee. We have Dr. Christina Marzo, a specialist in family medicine, and Dr. Robert Carlisle, also a specialist in family medicine. Without further ado, we turn it over to our panelists.
Everything good? All right. All right. Good evening, HMA, and thank you for joining us this evening. This is the legislative update of April 2026. I'm joined by HMA Public Policy Vice Chairs Dr. Christina Marzo and Dr. Robert Carlisle. This is our HMA mission posted, and our legislative committee is grateful for the engagement of a diverse group of Hawaii physician voices from specialties, from primary care, academics, as well as public policy and private practice, and key non-physician healthcare consultants. In this 2026 session, HMA has focused on three core areas: access, quality, behavioral health. And we'll review some of the relevant measures, many of the relevant measures and resolutions in these areas that have moved forward or stalled. Just to lay the groundwork or set the stage in Hawaii from 2025 to 2026, we've seen federal Medicaid funding reductions combined with rising healthcare costs that threaten access across the islands. Medicaid is a critical source of coverage for Native Hawaiian and Pacific Islander communities, for Kupuna, for people with disabilities, residents in the neighbor islands, where provider shortages are already limiting access. So the increased cost sharing for patients combined with higher premiums and out-of-pocket costs are really driving many of our residents into uninsured or underinsured states, and it's delaying our care. It's increasing our reliance on the emergency rooms. These impacts are disproportionately felt on our neighbor islands. The Hawaii Medical Association is supporting mitigation strategies for federal cuts, for investments in patient support, and the protections for patient continuity of care. It's not advancing. So we'll start with the access section and SB 3324. Can you guys see that up there? For Medicaid home and community-based services. In Hawaii, care needs are growing, and Hawaii has a lot of unmet demand and persistent waiting lists for home and community-based supports. This measure is presently in conference committee. It's likely, to assign the dollar amount, but it will hopefully strengthen in-home and home-like residential supports, reduce avoidable institutional placement, support smoother hospital-to-home transitions, and better match services to patient goal and functional needs. We testified as HMA that home-like community-based residential options strengthen continuity of care and they relieve caregiver strain. They improve quality of life, and it's really important and practical to help Kupuna and people with disabilities stay safely in familiar settings, maintain independence, and remain connected to family and community. That was Bill SB 3324. For HB 1546, this is a measure you and I had discussed. This measure would establish a 3-year health coverage continuity pilot program within the Department of Human Services. Continuous access to health care coverage is obviously critical for early detection, disease management, and preventative care. Without it, we get delayed care, we get increased uncompensated care costs, and poor long-term health outcomes. There are many states that are exploring the different options for coverage continuity strategies, and Hawaii must carefully manage administrative complexity, affordability alignment, and alignment with federal subsidies. The risks are recognized nationally, and HMA in our testimony, we deferred to DHS and DCCA to make, to find those specific rule solutions so that there's clear eligibility criteria and coordination with marketplace coverage. Importantly, to not address these problems, the coverage gaps, the delayed care, the increased emergency utilization will occur, and they're well documented, and they're going to carry significant human and fiscal costs. So we did support this targeted proposal, and we hope that it can enable residents to maintain coverage during vulnerable transitions. I think you had some really good comments on the development of this proposal. Go ahead, Dr. Carlisle.
Thank you. This really fell under the category as we talked about during the Pulse on Primary Care talk. Do something, right? It is easy to keep or take our eye off the ball, but the one big beautiful bill is coming, and it's going to hit us, and it's going to hit Hawaii like a ton of bricks. And between the war in Iran and the other elements that come out of our federal setting, again, super easy to lose track of the fact that January 1, 2027 is coming. This particular bill does indeed help those who are looking at losing their quest coverage with the changes that are heading our way. That said, it's going to be very interesting to see if it gets out of conference committee. Factually, I was very happy and pleased that it got this far.
I know.
It did fall under the category of do something. If you're not going to do this, then what are you going to do? But if it does go forward, it is looking at costing the state tens of millions of dollars in subsidies for the vouchers on an annual basis. And then the fact of the matter is we also have the reality that this really caught DHS by surprise. I don't think they were really ready to take this on administratively. So there are a couple of big obstacles to come with it. But if it does go forward, it'll be very interesting to see if it does help bridge that coverage. This is important for the physicians of Hawaii. It's important for the healthcare entities of Hawaii, and it's important for the patients of Hawaii who are losing it. Otherwise, so many of us are looking at 15% cut in how we are funding ourselves to provide care to all of us around us.
I think in the subsidies, is this the subsidies up to $1,000 per participant? Is that part of the subsidies?
Dig a little bit deeper into that. This with the other similar but different 5-year pilot program has different subsidies at different levels set out. And factually, when this bill first came out, I was not aware of the tens of millions of dollars, and it was when it was at hearing and the state senators pointed it out that it was going to cost tens of millions of dollars towards the state budget. That came as quite a surprise to me.
You're right. I think I was confusing it with a different vehicle. That was the portability for non-traditional healthcare workers, where we were trying to find a solution for that group, but then we would be creating a new risk pool, and there were all sorts of insurance regulatory problems that we were going to face with that. So then we turned to this one, hoping that this one would work, and fingers crossed, like you said, that it will make it out of conference committee. Any other comments?
I mean, I do want to echo Dr. Carlisle's thoughts about this. I think that the worst of HR 1 has not really hit us yet, because many of those changes are going to take effect as of January 1st next year. I think we're in a good position to try and get out ahead of these things Now, there are other areas where we're kind of falling short. And for example, some of the GET exemptions on groceries and things like that didn't move forward. And there are going to be a lot of families suffering. But at least from a healthcare standpoint, we are putting some of the things in place. So the urgency is not right on our heels at this time. But if a lot of these things don't make it out of committee, we may be in a very different position come next session where it's already the problem is at our feet. And so I hope we can get these really across the finish line.
I think that the lawmakers are trying very hard to find good solutions. So fingers crossed, but it is a scary time and we're not through the worst of it yet. So we'll move on to HB 1965. This bill and its companion went through a bunch of different changes, from primary care spend of 12%, and then it was a primary care spend that was 6% to 12%, and then to create the primary care providers work group within the State Health Planning and Development Agency. HMA supported all iterations of this measure, and we submitted support that this would strengthen access to timely, comprehensive primary care across the islands. Hawaii continues to face persistent physician workforce shortages, particularly in rural and neighbor island communities. And the patients are really increasingly relying on fragmented episodic care when they don't have a stable medical home and it's unavailable in their area. So strengthening community-based primary care grounded in long-term patient relationships and team-based collaboration, that remains absolutely essential to improving healthcare outcomes for Hawaii's keiki, our kupuna, our families. So this measure was last heard in HHS in March 18th, and it was not heard by Senate Ways and Means. The interest groups and stakeholders will still informally convene this summer, and they're going to address issues related to and develop recommendations for the stabilization of primary care services in Hawaii. On this slide, I did include some other measures that I think are relevant to access, and they didn't get as much press and attention, but I think were very important. SB 2261 from Molokai, this measure requires Huli Aola to conduct a study on physician and dentist recruitment and retention located on and serving the island of Molokai. I think this measure is presently in conference committee, likely to assign the precise dollar amount. And HMA feels this is a significant step with getting meaningful data to press forward the workforce challenge issues and look at the dental and medical care in rural areas like Molokai to inform the legislature of priority needs for workforce housing, available transportation, airline availability, community partnerships, and infrastructure. As we stated in our health and finance committees, systematic root cause analyses for our rural and underserved communities, it's absolutely essential to achieving health equity across our islands. I think that was a very good measure that's moving forward. SB 2969, this measure would appropriate funds for the University of Hawaii to expand and sustain services provided by the Maui Wildfire Exposure Study, Maui West, WES, and Maui Health Registry. It is presently in conference committee, again, likely to assign the precise dollar amount. HMA supported all of the Maui West bills. There was another one with emergency funding. Maui West has combined biomonitoring. It has healthcare screenings, biospecimens, socioeconomic data to track healthcare outcomes among the affected residents. It's now included over 2,000 participants, and it really does represent the most comprehensive post-disaster health study in Hawaii's history.
So, Dr. Ignacio, you've
Yeah.
mentioned conference committee a couple times, and we do
Yeah.
have some deeply engaged people on Zoom and presumably here in the room. Sorry, I'm not intimately
Yes.
familiar with everybody. But for the uninitiated, I wonder if you could expand a little bit on that and what it means to be in the conference committee and what it takes to get a bill to there and out of there.
Wow, that's a lot of questions. But yes, I mean, I can elaborate insofar as my limited knowledge. I'll probably rely on our legislative team to also comment. But getting to conference committee is a positive thing. It does represent that there are some differences in the Senate and the House on a particular measure, sometimes specific, sometimes on specific provisions, but many times those things have been worked out in the subject matter committees. Sometimes it's to assign money, like to make sure that we're assigning a precise dollar amount because the budget is not set. And so in conference committee, a lot of things can happen. You can discuss any other amendments that may have been tried and failed during the session or were considered, but then maybe moved aside for a different version. And you can even, switch back to some other original amendments or forms that were looking more viable. I'm going to ask our legislative team, including Mark Alexander, if he could please comment further on conference committee and the details of how you get there, how you get to participate, and who the conferees are.
Sure, I'll go ahead and add some further comments, Dr. Ignacio. I'm off camera. The conference committee is a really critical time, and the only way someone can be appointed as a conferee is if they have voted in favor of the bill. So that's why sometimes when people just look at voting records, that's not always a good way of gauging where a representative or senator really stands, because sometimes they'll vote with reservations so they can be a part of the continuing discussion in the conference committee. Usually conference committee, there's not much, quite frankly, that the general public can do because the conferees, they're working out their differences and they're negotiating. And sometimes there's a little bit of horse trading on different bills that's taking place as well. That's just all part of the dynamic. And as you pointed out, Dr. Ignacio, the only real amendments that can be considered are those that have been discussed in previous committee hearings. And the reason for that is they want transparency before the general public so that the public is really fully engaged and is apprised of what the discussion looks like.
Thank you, Mark. Did that answer most of your questions? Okay. Good. We can always come back to that for further clarity and further detail. I'll go along to some resolutions that I think these were pretty important for access. There was a resolution, HR 129. This resolution is on clean claims. And as many of our private practice physicians know, delayed reimbursement for healthcare claims, it continues to place significant financial and administrative strain on physician services. So particularly in Hawaii resource-constrained areas and in rural neighbor islands. So even if there is existing clean claims requirements, there is a variability in claims determinations and limited enforcement that contribute to ongoing delays. It can disrupt our patient care and patient access. So HMA did support advancing this resolution and consistent implementation of clean claim standards that could enhance compliance through data reporting, through system level improvements. I think continued efforts are needed to standardize claim processes and improve accountability mechanisms. HMA does really appreciate that our legislators are ongoing commitments to support the sustainability of medical services, especially in our neighbor islands. And that resolution was adopted on April 9th. Another resolution of interest was SCR 50. HMA supported this resolution as amended with comments. This is the one for SHPTA to have a health plan working group. We supported this resolution, and we did acknowledge the comments from Department of Labor and Industrial Relations. We have to carefully consider the Hawaii prepaid healthcare law. This is something that you're often bringing up when we're talking about new legislation. HMA also respectfully did recommend that we have one physician representative from the Hawaii Medical Association included on the working group. We really feel that physician representation is essential to ensure that clinical perspectives, care delivery realities, and patient-centered considerations are meaningfully integrated in the development of any proposed coverage model. So I do appreciate that the lawmakers keep trying to explore sustainable pathways for maintaining coverage in Hawaii. And this resolution passed out of health and it's on its way to the Senate. So another resolution of interest is SCR 27. This resolution urged that Maui Health collaborate with the administrators of the Hawaii Rural Health Transformation Plan, the UH John A. Burns School of Medicine, and other stakeholders to establish a Maui residency program on the island of Maui, of course. So I think it goes without saying for a lot of our academicians and educators, we know that to expand graduate medical education in underserved areas, it's one of the most effective ways evidence-based strategies to improve long-term physician recruitment and retention. So a residency training program can strongly, bring residents into a community to train, and it's an investment in Maui's healthcare and workforce stability there. So a Maui-based residency program will enhance care coordination. It will support physician-led team-based care and improve access to care for the local patients. But HMA supports this resolution and again is grateful to our Hawaii lawmakers. This is important for us to locally train physicians in our workforce in Hawaii and improve health equity across the islands. I think that there's already a program underway for Kauai that's almost up and running.
First class has been matched starting July 1, 2026.
Yay.
Orientation schedule has been built.
Woohoo! We're on our way.
And just clarify, it is a family medicine residency program.
Sweet.
So hopefully bringing more primary care doctors into those rural communities, training them there, keeping them there. We hope it's a success.
Thank you. All right, so we're going to move on to the quality section. And there's no debate, obviously, that all patients deserve high quality care, regardless of their economic status and geographical location. Team-based healthcare led by physicians should remain the standard of care in Hawaii, and Hawaii should get coordinated, high quality, and patient-centered services. So in this section, there are a few measures I wanted to cover. We'll start with HB 1970. This was the one for UH Cancer Center, maintaining robust cancer surveillance through the UH Cancer Center Tumor Registry. The registry is critical to tracking trends over time, identifying disparities, and looking at the impacts of public health interventions. So it's essential to reducing the cancer burden statewide and improving health equity for our diverse communities. HMA strongly supported this measure. The Hawaii Tumor Registry serves as a foundational public health resource that benefits the entire community. We did specifically state that that support should be reflected from the public investment, not funded through the UH tuition fees and special fund. And we hope that those appropriations will appropriately be aligned with the broader statewide impact that UH Cancer Center Tumor Registry has. I think this registry projection and the trend data are vital to quantify the ongoing burden of cancer in Hawaii. And the measure is presently in conference committee, again, to likely assign the precise dollar amount. All right, moving along to SB 2491. Okay, this measure was for qualified healthcare providers in Hawaii, and it lost momentum, and HMA has some ideas of the whys. This measure would have established a broad definition of qualified healthcare provider in numerous areas of existing law, clarify and standardize references to specific healthcare providers, and update a lot of outdated language to reflect correct terminology. We did strongly support this measure to provide a consistent definition of qualified healthcare provider that encompasses Hawaii licensed healthcare professionals. The conforming amendments, they would have or they could have removed barriers that prevent licensed providers from practicing within their legally established scope. But I wanted to stress and underline and bold again that the defined scope of practice exists in the individual healthcare professional practice acts, ensuring that statutory references do not contradict professional practice authority. This is not a scope measure. This alignment would allow the highly trained clinicians to deliver their care and be competent under existing Hawaii licensure standards. So this bill did stall after HHS and CPN. And before the session, we had some strong general support in the House as well as Senate on this. But in the retrospectoscope, I think that our review group probably didn't do enough education and outreach on this massive, complex project. The research and analyses had taken place over up to 3 years prior. So we were working constantly, meeting constantly in the past 3 or 4 years. And I think through the normal cycling of policymakers and if the handoff isn't clean, then I don't think that 2491 was lifted up in the priority list for the non-subject matter committees. And so we got lost in that grand sweep of the legislative session and the movement of all the business. So I know that HMA and all the stakeholders on this measure, including the Hawaii Academy of Physician Assistants, the Hawaii Pharmacists Association, Hawaii Association of Professional Nurses, et cetera, all of us remain committed to this, and we'll work through the summer to improve understanding on this complex measure. I think it is still definitely worthwhile collaborative project, and that all healthcare professionals can benefit from clear, consistent professional practice in Hawaii. So we'll to be continued on that one. Go ahead.
And if I could just add one comment on that, though a lot of people may have heard this before, that is a truly massive bill, 300 pages in length, that I had the pleasure of reading 3 times. So
Appreciate
it's
it.
20 times longer than even the longest bills that we typically see.
There was a lot of work in that, and you're right, it was really long. So we were thinking that it was brought up during our research and analyses whether we should break this up into smaller pieces. But because we had stakeholder support from Department of Education, Department of Human Services, we got to all the departmental support, and that we felt like there was good understanding there. We had a lot of agency support, but we did not do our best with the actual lawmakers. So, fingers crossed that we can continue that outreach this summer, because it is a lot. Agreed. All right. HB 1898, we'll move on to this one. This measure and its companion went through some changes. It started with accepting both the Advisory Committee on Immunization Practices, the ACIP of the United States Department of Health and Human Services, that standard, as well as the standard by the American Academy of Pediatrics. And then allowing the Hawaii Department of Health to have some voice in the final state recommendation. So it was plus or minus the creation of the Preventive Services Advisory Committee. That was part of SB 3133, and there were some iterations of this measure that went back and forth with including that language. That would have included 10 members to advise on preventative health standards, including the Hawaii chapter of pediatrics, the Hawaii AFP, the HMA, ACOG, Hawaii Association of Healthcare Plans, the Hawaii Association of Hospitals. It would have included everybody on there, 10 members. And HMA supported all versions of this measure. So we do appreciate, the attempts to strengthen vaccine guidelines and align with best practices. Still think that it is kind of tough when you're trying to balance these two standards in this measure, but we think that it was in its present form that it's okay and it's moving forward, and DOH agrees. So we're following DOH's lead, and there was also some language in there about pharmacy and vaccine ordering and administration. So we did ask for them to be, careful, and deferred to DOH in terms of developing the information systems to ensure patient safety and continuity of care. That measure is also now in conference committee. Comments on that one? All right, so now we're going to move into behavioral health, and little brain cleanse there because there's so much information, right? But across the country, there are national structural deficits in mental health services. So it's not just localized gaps. And I think all states continue to beat back all the barriers and challenges of providing good, quality, safe behavioral health care. And in this section, we'll start with SB 847. Okay, this measure went through changes, and in its present form, it would establish a 3-year pilot program in the county of Kauai to allow qualified psychologists under the supervision of a supervising psychiatrist with limited authority to prescribe psychotropic medications to patients between the ages of 18 and 65 and under the care of the psychologist. It would require the Board of Psychology to adopt rules and require SHPDA to report to the legislature. So HMA strongly opposed independent prescribing of psychologists. As we stated in testimony, we work closely with Hawaii Psychiatry and Medical Association on this. We stated that many patients with behavioral health conditions also have significant medical comorbidities. In daily practice, physicians routinely evaluate how psychiatric symptoms intersect with pediatric and adolescent development challenges, diabetes, cardiovascular disease, pregnancy, aging, substance use, chronic pain, polypharmacy. So complex patients are not edge cases in Hawaii. They are everyday reality. And HMA testified that integrated solutions are safest, and they're far superior to isolated or fragmented care. So we do appreciate the efforts of the House committee. The Committee on Health tried to incorporate some safeguards, including psychiatrist supervision. We did define some patient parameters, limited formulary, and reporting through SHPDA. So given the complexity of patients, the safety guardrails, I give it a B minus, C plus, and we do hope that they will hold their line in conference committee and make sure that this is truly a pilot, that it has a beginning and an end for evaluation so that it can be truly evaluated on its own merit, that it has frequent oversight, that it's not just like at the end of 3 years when we don't really know or track like what the safety issues are and try to course correct as it goes along. And so we're also hoping that we can have representation from, pardon me, representation from the Hawaii Board of Medicine as well as psychology, right? That makes sense. So we're hoping that they will really pay attention to their escalation protocols, to their outcomes, their complications, and we'll see what happens. This measure is going to conference committee.
And this bill was very interesting to watch go through. The word psychotropic is a very broad term. And then this is further complicated, similar to the qualified healthcare provider law, by how the state of Hawaii defines Schedule 2, Schedule 3, Schedule 4 substances, right? They are distributed all over the place, and it is not consistent and is very, very confusing. But as this bill first went through, the overwhelming majority of testimony was against it. And then as the bill got whittled down and refined and whittled down and refined, the tide turned and the testimony in support of it far outweighed that against it and in opposition to it. So this was a very fascinating bill to see move through the House and the Senate so far. It will be interesting to see what the future holds with it. And as you not alluded to, but as you stated very clearly, HMA, all of us have to be very clear that this cannot be a scope creep where SSRIs and SNRIs turn into benzodiazepines and turn into stimulants and we have enough problem with overprescribing without making access to very important and appropriate medications perhaps a little too easy.
Exactly. That is a really great point. I will push back, though, that even though that there was some turning of the tide in terms of testimony, there was a significant amount of testimony that was out of state. So actually, like Hawaii, there was a significant amount of people there that were still opposed to it. And this is a pilot that's happening there. Right. So
there was a lot of testimony from Arizona.
Yep.
Not sure if they also testified in support of a remote telehealth bill, but different issue.
Yeah, good point there too. All right, so let's see. Next measure on this slide, SB 2089. This is the Medicaid Mental Health Services Expansion Bill. So this measure would expand the services eligible for Medicaid prospective payment system reimbursement to include services furnished by a federally qualified health center or rural health clinic and provided by mental health professionals under the clinical supervision of a licensed mental health professional. I thought the language on this measure was a little confusing and vague at the beginning, but as the testimonies and the description moved through the session, I learned more about that we were talking about licensed clinical social workers, that we were talking about preceptors and non-physicians. And HMA supported the intent of this measure, but we did want to make sure that unlicensed mental health professionals who are delivering care, we wanted to understand what the competencies were, what the specifics of supervision were, and we wanted to have defined minimal supervision standards, patient notification, quality and safety reporting, and a lot of that has been moved into the measure. We do support all these efforts to expand behavioral health services, and of course, we want to do that safely. So let's see, that one is moving forward. And the next one on our list is HB 1562. Now, this one is in orange because it didn't move through, but this is just an example of many of the measures that were great ideas that I personally would be very excited about moving forward. They just didn't go because we were floundering with a lot of our money issues, with our issues with funding and finding funding for our Medicaid programs. Sorry. So I think HB 1562 for Digital Youth Mental Health Platform, I really applauded the legislature's direction to strengthen early prevention and education on mental health for our youth. I think having a tailored education program would really address some of the resource issues in our islands. And I also think that a provider platform like this can be tailored to the cultural and geographic needs of Hawaii, which are different, than other states. So this measure made it through both the chambers and health committees, but ultimately it was not heard by Ways and Means. Okay, I'll touch on this one, SB 3199, only because I've had so much of some physicians concerned about this, and I think it's worth mentioning. SB 3199 is the measure on mental health emerging therapies, and it's related to creating a task. I have a lot of reminders. I think I need them. But a lot of emerging therapies, including psilocybin and MDMA, things like this. And so we did initially submit supportive comments on the intent of this measure to allow for some thoughtful preparation for emerging mental health clinical innovations in Hawaii. We do obviously emphasize patient safety, equity, cultural context, et cetera, for this task force. And we supported the addition of, or the specific addition of, a psychiatrist, a physician on this task force. I think it's important for physicians to be represented on any task force such as this. In its latest version, this task force is placed under the JABSIM, and HMA does feel that would be an appropriate place to vet scientific evidence. This is not necessarily the way we have in the past looked at emerging therapies. Usually we do go through more conventional pathways of trials and making sure, obviously, that there are resource issues, and we've looked at it from a very careful scientific perspective. So we are looking at our national organizations in terms of what they are recommending in this regard. But we do want to keep tracking these, and we want to be involved in the conversation. So that was the direction that HMA was going on for that. And this measure would not legalize psilocybin or MDMA, and the measure presently in its present form is in conference committee. Are we doing okay with time? I think we have, yeah, we're good. Okay. So I'm going to put this in here. This is a slide of special interest stuff, of special interest issues. And I know that Dr. Marza will have some really good comments on these education measures. So this is HB 1574 on the loan repayment. And this measure would formally codify the healthcare education loan repayment program and require participants to have a specific number of years that they would have to serve in based on how much money or financial assistance they got. And presently, the HELP program requires a minimum of 2 years, and regardless of the amount of loan that you get. The HMA did support this measure, and it offers a sliding scale of work commitment based on the amount of loan repayment assistance that participants receive. So any thoughts on that measure for the new work requirement?
I mean, I think the program has proven to be a pretty big success in terms of recruiting, retaining physicians, and not just physicians, but providers across the entire spectrum, nurses, social workers, even techs. Yeah. And making sure that we have a future for this program, I think, is so important for building a strong workforce.
Absolutely. I'm so glad this is moving forward. I was worried it was going to get lost in the shuffle, and it's in conference committee now, again, probably to assign the money amount. Yeah. HB 1591 is also the preceptor tax credit bill. This is the measure that's also in conference committee, again, to assign the amount of money to it. So it does add the physician assistants, the dietitians, and social workers to it. And it would help sustain and grow the Hawaii healthcare workforce. So we strongly supported this in all efforts to address healthcare professional education. Any comments on the preceptor tax credit?
Again, another vital part of our medical education training, making sure that we have a sustainable workforce. Our medical school, UH, is community-based, and a lot of the training comes from community-based providers. We don't, as a school, have a way to compensate many of them. And not that a lot of them want or need the compensation, but you know, taking on a student does take time, and we want to show that we are appreciative of the work that they're doing for us. Without these preceptors, we have no medical training. We have no program here. So making sure that we are showing these people that are showing up for our students that they are valuable to us is super crucial.
Thank you. Completely agree. Okay, some other measures that I put on here is our HB 1514 and HB 1515, which are related to workmen's compensation. This measure, the HB 1514 is in conference committee. This measure would clarify the process for selecting a certified provider of vocational rehab services and requires certified providers to automatically approve vocational rehabilitation services. And HMA did support this measure. I think that there's a lot of issues with administrative complexity with workers' compensation. And HMA supports this measure because it would clarify those vocational rehab services that follow initial evaluation and really help tighten up the timeline for them to get the treatment that they need. The other one that's similarly related, HB 1515, that measure would authorize the attending physician to request a functional capacity exam and refer an injured employee for the examination without first obtaining an approval from the employer. And these might sound pretty dry to you. You're like, these are not glamorous measures. And admittedly, workers' compensation issues can be pretty dry, but these are not major controversial or volatile issues, but they are significant barriers in Hawaii for care that is needed. So these measures have been proposed and refined over several years, and HMA Public Policy Committee is pretty excited that these might actually move through now. So I also bring up HB 1875. This has been of special interest to our OBGYN colleagues and all physicians. And this measure would expand the protections established under Act 2 to include gender affirming care, healthcare services, and include clarifying to permitted disclosures of protected health information to address changes in federal regulations. It's a very long measure. So HMA supported this measure. We appreciate the collaboration of our OBGYN colleagues, and it was amended by the Senate. The decisions about medical necessary care, including gender affirming care, should be grounded in clinical evidence and really should be made between the patients and their clinicians. So we are glad that this measure is moving through. Medical care should really be inclusive and respectful and evidence-based, with these policy efforts to really facilitate access to appropriate services and eliminate barriers to quality health outcomes. That measure, it's in conference committee. So there are many other bills that HMA can put into the special interest category. HMA consistently testified on measures for aeromedical services, ambulances, artificial intelligence, glucose monitors, fingerprinting, syndromic surveillance, colon cancer. HMA, we really did our best to be present for our Hawaii physicians and our patients and for our lawmakers, and interfaced with peds and family practice, ER, hospitals, palliative care, and we're going to continue to support all of these critical issues that our patients and the public is often unaware that they're pending in our legislature, but they are impactful to the healthcare in our state. So that's our general review. I don't know how much time we have left, but I do want to ask if there are any other questions. It's hard for me to see the question queue here, so let me come out of.
You see a question up there that I'll be happy to answer if that's okay.
Sure.
It says, does HB, I think that's 1546, cover COPA migrants that may have lost Medicaid eligibility due to HR1, the one big beautiful bill, which again is being rebranded as something else, which I've already forgotten. And so the answer, I believe, is it should not affect COFA migrants, because these are folks who will no longer be on Medicaid or Quest and will also ostensibly not be under Medicare. So they are in that true loss area, and they'd be covered by a program that is in no way, shape, or form related to the federal government, solely paid locally here and supported by the state government.
Are there any other questions from the room or comments? No?
I think if I could follow up on one of the comments from one of our folks in the room, and dare I say the people online couldn't hear it. She mentioned the testimony that came in from out of state on Bill 847 on psychologist prescribing authority. It really reinforces something that we have learned so many times before and something that we continually try to share, which is the importance of the amount and the number of testimony that our legislatures receive as they make these decisions. Our individual testimony as physicians, when we go to capital.gov, capital.hawaii.gov, and we make those submissions, they really do add up. And our legislatures will literally add that up and say, we've got 74 people in support of this, and we've got 24 submissions in opposition for it. And as I was sharing before, it was very curious to me to observe this inversion of the support versus the opposition for the psychologist prescribing authority from its start to its end. And our person here in the room pointed out that so much of that testimony and support actually came in from out of state, but it was counted to the same level and to the same degree and with the same credibility as the in-state testimony, at least in terms of just absolute number counting.
Agree. I think it's an important point.
Yeah, I mean, I think for many of the bills, we as HMA or from our other professional organizations, if we submit testimony on behalf of that organization in support or opposition, it does have a little bit more weight. But these lawmakers are reviewing so many bills, and in a lot of these hearings, they're not going to read every single piece of testimony. They're just going to say, this is how many were submitted in support, and these were how many were submitted in opposition. And some of the more thoughtful ones may be able to comb through that. When you get like several hundred pieces of testimony, there's no way.
Even though they're looking at the counts and they're tallying up the pros and cons, it's such a busy time, the whole legislative session. And that's why the advocacy has to happen year round. It has to happen this summer and in the fall and in preparation in the winter. So I just encourage all of our HMA members to please stay engaged, to please continue supporting our mission, because this is something that we have to constantly re-educate, continue to reach out, look at all of our partners, our collaborative partners, all the stakeholders and interest groups, and try to come up with good consensus before, because once we're in the session, once we're in the hearings and stuff, if they're just going to tally them one at a time and like this, it's not necessarily going to speak to the reality of the issues and the challenges that we're facing. So I think that in addition to the session, which we're glad that people are engaged and excited about, we want people to please continue to stay engaged off session. It's hard to do. Some of the language can get really dry, but so important to be watchful and communicative with our different collaborative groups. So
if I could take a moment to point out another positive from the session, and that is the Farm to Families bill, which is designed to help a couple things. Number one, support our local farmers and agriculture. So local sustainable agriculture analysis in the past has shown that if we use 20% of the land in Hawaii for agriculture, we can actually feed everyone in Hawaii and not be dependent on imports. That's one thing to say. But also with this is moving the food, healthy food, local, sustainable from the farms locally to the families, specifically the families with children here. Again, as we are looking in the state of Hawaii at substantial financial headwinds that our working families are facing, this is going to be at least a small help to them with that. Now, I will say that there's a curious element in there about including coffee in this delivery. And as the bill is focused on the keiki, the coffee element is interesting to me, but I think it shows that our coffee growers have had some input on this bill as well. But I would say this is a success, and specifically a success as we are looking at the adverse effects, the anticipated adverse effects of the One Big Beautiful Bill, as well as the changes to the state finances over the next 2 to 3 years.
Thanks for highlighting the one. I think that's a really important one. And there are so many measures that you don't get to see all of our work on. So please look at the HMA website. all of our testimonies are there. There's 3 bajillion testimonies that we all worked on collectively. And we want you guys to see and to chime in on your thoughts on how these measures have turned out. So many that we didn't mention today in our session, but were also very important. So please look at our website. You can see all the different issues that we've been tracking and working on and that we will continue to work on through the summer and the fall. And if I may, before I go, I want to just say a big mahalo to all of our engaged physician advocates, Dr. Peng, Dr. Gotu, Dr. Marza, Dr. Carlisle, Blaisdell, Maxim, Simonson, all of you, you know who you are. I do also want to thank our HMA executive leaders as we move through the end of the session, Dr. Nadine Tensel, Dr. Jerry Garcia, Dr. Leighton Payne, because it is very important for our organization that we work together and that we have these officers, we're all working together, stay on point on these issues. So thank you to our HMA physicians. I'm just very appreciative for everyone working together this session. Oh, is there another question? Yes.
So I believe the question says, isn't it important for members to contact their elected officials and let them know about issues important to them and support the elected officials? And the answer is absolutely positively yes. The elected official from your district on an individual, as an individual, will have so much more interest in what you have to say if you live in that district, as opposed to what Dr. Marzo or myself or Dr. Ignacio have to say if we don't live in that district. If when you reach out, you say, I am a registered voter in your district and I vote, they should very rapidly respond to you. Now, I will forewarn you, as we go in and we talk with these officials, I always start with, what's on your mind? What are your bills of note? They can share some things, and they finish it with, isn't that a great bill? Wouldn't you like to support that? And I just say, well, maybe that's very interesting. Let me tell you about some things that are on my mind. And so you do have to be equally open to surprises that they may throw your way, in addition to what you may have to share with them. But absolutely engage with the local officials. And if they're not engaging with you, keep pushing that button because they should engage with you quite rapidly. And at least 70 to 90% of them, they will respond to you within 36 hours. I think you have to be really worried about your elected official if they are not responding to you and they're in your district.
And if they don't, you know how to vote.
Did you want to close up or should I?
Thank you very much, Drs. Ignacio, Marzo, and Carlisle, for your very insightful discussion this evening. And a big mahalo to those who've joined us in the room and on Zoom for your questions and for giving us some of your time this evening. We know that you have your choice of evening activities, so we're grateful that you've chosen to spend some of that time with us this evening. Please look for more information about the legislative session. It ends on May 8th. Find more information on our website and the members-only special section in particular. If you have any questions, you have any suggestions for future conversations at HMA, please feel free to email us at info@hawaiimedicalassociation.org. And again, this recording will be available within a week on the HMA YouTube channel. Again, mahalo to our panelists. Have a great evening.